Hello everyone, I am urologist Omar Erdamakaya. Today we are going to talk about whether Tongkat Ali really increases testosterone, if so how much, and the purposes for which it is used. Tongkat Ali is a plant that has been very popular for about 10 years, grown endemically and used frequently in the Far East. In countries such as Indonesia and Malaysia, people use the aqueous extracts of the roots for complaints such as infertility, loss of sex drive and erectile dysfunction. Well, let's take a look at the publications that have been very popular recently. How much does this really increase testosterone and to what extent? When we read the short summary of the publications, it seems very optimistic. It shows that it increases by around 47%. But when we go into the full text of the articles, we can say that it disappoints us a little bit. Now let's take a look at the full summary of the publications. As you can see here, in the most popular and most quoted publication, it says that they increased testosterone from 5.6 to 8.31. So what range is this 5.6 and 8.31? When we look at it, it talks about the reference range between 30. So it's not for the reference range of 200 to 800 like we have. In the reference range here, the optimal testosterone level should be around 18. The level of hypogonadism should also be between 10.12. They themselves set a limit of 6 as hypogonadism and say they have increased it from 5.66 to 8.31. They say that they brought the patient's testosterone levels into the normal range. But we have to say that the normal limit is at the very bottom of the range. I can tell you from my own clinical experience, that we don't expect much benefit from raising testosterone that much. It may be that the patient's symptoms of erectile dysfunction are getting better because of other benefits of Tongkat Ali. There is another study, related to sports, on whether Tongkat Ali increased weightlifting. They used Tongkat Ali for 5 weeks. After 5 weeks of use, as you can see in the table, they found that those who used Tongkat Ali started to lift more weight. They stated that this was statistically significant. But see the table for yourself. The weight lifted by those using a placebo also increased. The weight lifted by those who used Tongkat Ali also increased, but I don't think there is a significant difference. There are meta-analysis studies. In the meta-analysis study where 11 publications were examined, it was found that it increased testosterone in 7 publications and there was no change in 4 publications. It was found that there may be a possibility of increasing testosterone, especially in those with hypogonadism, that is, those with low testosterone. But they did not see much difference in those with testosterone in the normal range. However, as I said, in many publications, it has been shown that there is no change in testosterone or any hormone. There is a study on the use of Tongkat Ali in athletes. It says that it has been determined that there is a significant increase in strength, ergogenic increase, and sports adaptation in about 5 weeks. This publication says that after 5 weeks, an increase of 1.8 centimeters in arm circumference was detected. Above all, friends, it must be said that no herbal product can be used for years. It can't be used for a year or 2. About this Tongkat Ali, I have to say that the longest study I noticed was around 6 months. If you don't pay attention to your exercise, stress management, nutrition, micronutrient intake and sleep patterns, it would be too optimistic to hope to increase your testosterone levels by taking any herbal supplement. So if you are not doing these things, I think you do not need to use any herbal treatment. Weight management is also very important, friends. We've done a lot of videos on testosterone in the past, you can check them out on the channel. Studies have identified side effects of Tongkat Ali, such as dizziness, nausea, headache, increased heart rate, shortness of breath, irritability. But I have to say that Tongkat Ali is unlikely to have side effects according to studies. There are no fatal case reports like yohimbine. By the way, reports of side effects in animal studies have occurred when very high doses were used. I have to say this about Tongkat Ali, the animal studies are very successful, but the doses used in animal studies are really very high doses. It was used in mice at a dose of 250 milligrams per kilogram. In a 70 kilogram human, that's almost 20 grams, and that's a very high dose. There is no such preparation on the market. The preparations already on the market have a daily dose of around 200 to 400 milligrams. The results of Tongkat Ali on erectile dysfunction can be called positive. Can it be used? Yes, it can. But if you are thinking about a supplement for testosterone, you click on the link I will give you below. Thank you for listening. Best regards.